Hello everybody, this is Joey from NCLEX-RN in Focus. Please do subscribe to my channel and hit the notification bell so you'll get notified when a new video comes out. Thank you so much for your time. Our topic today is about change process. Change is a dynamic process that leads to an alteration in behavior. Change agent can be used to effectively facilitate change, appropriately assess and manage the reactions of staff members. They can connect and balance all aspects of the organization that will be affected by change. Leadership style. It influences the approach to initiating the change process. There are three elements of successful change. 1. Unfreezing. It is the first phase in which the problem is identified and individuals involved gather facts and evidence supporting a basis for change. 2. Moving and changing. Change is planned and implemented. 3. Refreezing. The change becomes stabilized. Types of change. 1. Planned change. A deliberate effort to improve a situation. 2. Unplanned change. A reactive response that is required because of a disruption. The change is beneficial and may go unnoticed. Resistance to change. 1. It occurs when an individual rejects proposed new ideas without critically thinking about the proposal. 2. Change requires energy. 3. The change does not guarantee positive outcomes. Reasons for resisting change. Conformity. One goes along with others to avoid conflict. Dissimilar belief and values. Differences can impede positive change. Habit. Routine set behaviors are often hard to change. Secondary gains. Benefits or payoff are present, so there is no incentive to change. Threats to satisfying basic needs. Change may be perceived as a threat to self-esteem, security, or survival. Fear. One fears failure or has fear of the unknown. Overcoming barriers. 1. Create a flexible and adaptable environment. 2. Encourage the people involved to plan and set goals for change. 3. Include all involved in the plan for change. 4. Focus on the benefits of the change in relation to improvement of client care. 5. Delineate the drawbacks from failing to make the change in relation to client care. 6. Evaluate the change process on an ongoing basis and keep everyone informed of progress. 7. Provide positive feedback to all involved. 8. Commit to the time it takes to change. Conflict. It is an internal or external friction that arises from a perception of incompatibility or difference in beliefs, attitudes, values, goals, priorities, or decisions. Types of conflict. 1. Intrapersonal. It occurs within a person. 2. Interpersonal. It occurs between and among clients, nurses, or other staff members. 3. Organizational. Occurs when an employee confronts the policies and procedures of the organization. Modes of conflict resolution. 1. Avoidance. Avoiders are unassertive and uncooperative, do not pursue their own needs, goals, or concerns, and they do not assist others to pursue theirs. Postpone dealing with the issue. 2. Accommodation. Accommodators neglect their own needs, goals, or concerns, and assertive while trying to satisfy those of others. 3. Competition. Competitors pursue their own needs and goals at the expense of others, also may stand up for rights and defend important principles. 4. Compromise. Compromisers are assertive and cooperative, work creatively and openly to find a solution, that most fully satisfies all important objectives and goals to be achieved. The second part of this video is about roles of healthcare team members. Let's start with nurses. Nurses promote health and prevent disease, provide comfort and care to clients, make decisions, act as client advocate, lead and manage the nursing team, serve as case manager, function as a rehabilitator, communicate effectively, educate clients, families, and communities and healthcare team members, act as a resource person, allocate resources in a cost-effective manner. Primary healthcare provider or specialist diagnoses and treats disease. Physician's assistant acts to a limited extent in the role of the physician during the physician's absence, conducts physical examinations, performs diagnostic procedures, assists in the operating room and emergency department, and performs treatments. Some have prescriptive powers. Nurse practitioner diagnose and treat acute illness and chronic conditions, promote and maintain health, may work in a variety of specialty areas including family practice, internal medicine, acute gerontology, women's health or obstetrics, acute care, pediatrics, or other specialty areas, have independent practice authority in most states. Physical therapist assist in examining, testing, and treating clients recuperating from injuries, illness, or surgery, and physically disabled clients. Occupational therapist develops adaptive devices that help chronically ill clients or clients with a disability perform activities of daily living. Respiratory therapist delivers treatments designed to improve the client's ventilation and oxygenation status. Speech therapist evaluates the client's ability to swallow safely and evaluates speech and communication ability. Develops a plan to treat communication and swallowing disorders. Also, work to prevent, assess, diagnose, and treat speech, language, social communication, and cognitive communication in children and adults. Nutritionist or dietitian assist in planning dietary measures to improve or maintain a client's nutritional status. Continuing care nurse coordinates discharge plans for the client. Assistive personnel help the RN with specified tasks and functions. Pharmacist formulates and dispenses medications. Social worker counsels clients and families about home care services and assists the continuing care nurse with planning and facilitating discharge. Chaplain offers spiritual support and guidance to clients and families. Administrative staff or support staff organize and schedule diagnostic tests and procedures and arrange for services needed by the client and the family.